Yes, part of our QESP technician TeleMed practice, we're going to talk about emergency therapies, what to do. And today it's about diabetes. And see, a lot of people have symptoms of diabetes. And basically, these symptoms occur first because of hyperglycemia, too much sugar. They get extreme thirst with hyper. They get weakness. They're going to get blurred vision, possibly. They might not know it. Fatigue. They might not feel the fatigue. Frequent urination they will feel. Numbness, tingling in extremities. This is another thing. Simple blood sugar tests will tell them if they have diabetes or not, and what to do, and what do we do for emergency states of blood sugar.
Diabetes is a long-term medical condition where the body cannot produce enough insulin. Sometimes people who have diabetes may have a diabetic emergency where their blood sugar becomes either too high or too low. Both conditions are potentially serious and may need treatment in hospital. Hypoglycemia is where the blood sugar levels are high. It may be caused by a person with diabetes who has not had the correct dose of medication, may have eaten too much sugary or starchy food, or they may be unwell with an infection. A person with hypoglycemia may have a medical warning bracelet, warm, dry skin, a rapid pulse and breathing, fruity sweet breath, extreme thirst, or drowsiness leading to them becoming unresponsive if not treated. This is also known as a diabetic coma.
It's important to learn whether there's a hyper, too much blood sugar, or a hypo, too little blood sugar. Thirst, dry mouth, blurred vision. You see, these things, frequent urination, these things are hyperglycemic. But then that same patient can, at a different time, go hypoglycemic. Shaky, sweaty. Okay? We have to understand what causes this. Too much food and mismanagement of insulin in both cases. You see, hypoglycemic, hyperglycemic. These are the causes. And medication can be a major cause.
Call 999 or 112 for emergency help and say you suspect hypoglycemia.
That's good for Australia, but in America it's 911. In Europe, 112 is the emergency number.
While you wait for help to arrive, keep checking their level of response.
In a hyperglycemic state, make sure that this is an emergency and you've called 911, you've gotten some help. In the meantime, apple cider vinegar, cinnamon, fiber, berberine, fantastic, berberine, really work, fenugreek seeds. All these other little things can really help to bring down the blood sugar. Okay, very, very important. Also recognize that there are certain acupuncture points that you can use pressure on, acupressure. This is the key one, huku here. This is very, very good, hyper or hypo. These ones are also used, but most of these will respond for the hyperglycemic, okay? But you could try them. They're fairly safe to try, but if they don't really work, then you feel free to discontinue. Let's learn more. The berberine, contained in many natural herbs, is an opposite of sugar. We've done many papers proving this. It is fantastic at helping people that are in this position of the hyperglycemia. This is very, very good. It will also help to cure the diabetes. Fantastic stuff. Now you can get this Get Well herb, very rich, extremely rich in the berberine, in a UV protected package that will last on the shelf, protected from the ultraviolet rays. You can get this from Only Nature Knows. And the information will be down there in the captions below. You'll be able to get a hold of them.
If they become unresponsive at any point, open their airway, check their breathing, and prepare to treat an unresponsive casualty.
Yes, sometimes they usually go unresponsive slowly. You get a chance to talk to them. As you start to see them slip away, try to find help. If you're on the telephone, try to find help, neighbor, family, friends, somebody else. Don't you get off the line. Don't you get shook up. Relax, help them. If you are there, you can use the emergency acupuncture spot here by pushing on that. That will really help. If that doesn't help, then maybe there's something even deeper. So recognize, don't panic, try to help this person.
Hypoglycemia is where the blood sugar levels are too low. It can be caused by an imbalance between the level of insulin and the level of glucose in the blood. If a person who is receiving treatment for diabetes misses a meal or takes part in a lot of exercise, their blood sugar level will fall. On rare occasions, low blood sugar levels can occur after binge drinking and after having a seizure or epileptic fit. People who suffer from diabetes may recognize when a hypoglycemic episode is coming on or starting and know that they need to eat something to bring their blood sugar level up. They may have their own blood testing kit to check their blood sugar level, but sometimes they may fail to recognize their symptoms in time, and without help, they may quickly become weak, confused, and unresponsive. A person with very low blood sugar, hypoglycemia, may have a medical warning bracelet, weakness, faintness, or hunger, confusion and show irrational behavior, sweating with cold, clammy skin, a rapid pulse, palpitations, trembling or shaking, or may be less responsive to you.
Hypoglycemia occurs when a person with diabetes has not eaten enough food, or they have too much insulin within their body, meaning that their blood glucose levels drop low. The symptoms of hypoglycemia can cause a person to appear drunk. In addition, symptoms can also include tiredness, weakness, hunger, irritability, anxiety, and shaking.
If you suspect hypoglycemia, help the person to sit down. If they have their own glucose gel or glucose tablets, help them to take them.
We don't always want to use sugar, but these are the best foods in a natural way to deal with that blood sugar emergency. Okay? Peanut butter, if they're not allergic, peanut butter, very, very good. Honey, one of the best. Raisins, prunes, etc. Okay? Be sure to try these things. Applesauce, fantastic. Licorice tea. And of course, natural fruit, fresh or dry. This will help to improve their blood sugar and deal with the emergency.
We're going to whip up an apple and grape juice. We need a bowl of black grapes, which we take in a blender. Add a bowl of peeled and chopped apples. Put a little bit of water in there and blend. You can have this juice any time of the day to keep those blood sugar levels up.
If they improve quickly, give them more of the sugary food or drink and let them rest. If they have their blood glucose testing kit with them, help them to use it, check their blood sugar level and stay with them until they feel completely better.
The best points for the hypoglycemia still are here, there, our favorite little Goku spot, and also this stomach 36, down along the side. You can palpate this spot, this will help.
If they do not improve quickly, look for any other reason why they're unwell and then call 999 or 112 for emergency help.
911 in America, 112 in Europe.
Do not give them anything to eat or drink as they may choke. While waiting, keep checking their level of response. If they become unresponsive, open their airway, check their breathing, and prepare to treat an unresponsive casualty.
If they're unresponsive, try some pressure on this spot. Now let's learn about some other ways to deal with diabetes. In the pre-state, help to get the person out of that. Help to prevent and possibly even treat diabetes. Let's learn.
Okay, blood sugar.
Yes.
To get it down, you got to start first thing in the morning. So you're going to automate your breakfast in the morning with steel-cut oatmeal. Now, everyone knows I love steel-cut oatmeal, but let me explain one of the reasons I love steel-cut oatmeal. It's because it's soluble fiber. And so it's simple to make. The number one thing, start in the morning with steel-cut oatmeal.
Okay. Eating high fiber meals every 2 to 3 hours is the key to preventing low blood sugar. Make sure you gorge on fruits, nuts, salads, and sprouts periodically throughout the day to regulate your blood sugar levels.
Please teach people to substitute sugar in all recipes, to substitute applesauce for sugar.
Number two issue has to do with your lunch. Now, a lot of things you can do for lunch, but you're going to include non-starchy vegetables.
Okay.
So you get all the greens count. You know, I have some broccoli, some green beans. These are all high in fiber and they're low in carbohydrates.
There's a host of things to teach them, including moderate exercise, how to manage meals, but substitute the applesauce for sugar and use a balanced diet. high fiber balanced diet.
The starchy vegetables oftentimes grow under the ground. They have to store their energy there. So there are a lot of stuff that becomes sugar in your body. So you don't want those high glucose carbohydrates driving up your blood sugar levels. So be careful about the potatoes and the peas and things like that.
How often can I eat this throughout the day?
Well, you can eat as much as you want.
Now, there's so much studies about high fiber, whole plant diet as a cure for diabetes and also to restore cardiovascular health. There's vast research that shows this. Please get off of the meat and get into the high fiber healthy plants. Fresh and raw if you can, lightly cooked, stir fry cooked also.
Cinnamon is an incredibly powerful replacement for sugar. And the thing about cinnamon is it actually helps your body regulate its blood sugar by helping your insulin work better. Okay. So I put a little bit in here already, but you take just a tiny little bit, less than you would need with regard to sugar, add it to your coffee.
A whole plant-based diet where you're getting all the different fiber, switch from that processed spaghetti to whole grain spaghetti, whole grain bread. Switch to these things, get the whole
When you
plant.
mix it up, you'll actually find that it's a satisfactory replacement. It has a different flavor to it.
Okay.
But it's something that I think will grow on you pretty quickly. Do you like cinnamon at all?
Yes, I do. That's one of my favorite spices. So I could cut down on the sugar and just use half of the cinnamon?
You could use a quarter of the cinnamon actually, but you could.
Our bodies need fiber in order to make all the different chemicals that we need to support our brain. Our bowel needs fiber in order to do that. It's very important.
Go on 2 days a week. I don't want you eating meat.
Okay.
And I'm going to give you lots of recipes that you can replace the meat with. But the research over and over again shows that people who are vegetarians tend to have a lower risk of getting type 2 diabetes than people who are meat eaters.
Okay.
So part of it's the meat, part of it is what goes along with the meat. But here.
And the age-old wisdom was that about respect for nature, recognizing plants, seeds, fruit. Even the Bible tells us. Some people don't like the Bible, that's fine, but still, the age-old wisdom around the globe tells us this. We need whole plant foods.
I made you 2 examples of things you can have. It's a black bean burger, which I think is to die for, and the chili, which I would love for you to try, because I had it for my little snack today. You will enjoy eating these. Now remember, these are easy cheats you can incorporate into your day.
So I hope you learned more about diabetes, hypoglycemia, and what to do in an emergency way. I hope this was very helpful. Desiree Duvenet, signing off.